Hello, I'm Dr. Ladybeth Rodriguez. I'm the clinical psychologist in the pain clinic at Womack Army Medical Center for Bragg, North Carolina. Today I'm going to be presenting information on pain health psychology and how do we use psychology in the treatment of chronic pain. Psychology is part of the pain treatment because pain, specifically chronic pain, could be quite complex. The changes when you're dealing with pain go beyond physical symptoms. You may also experience changes in your emotional and social functioning. You may notice that your mood changes. You may feel more irritable than usual, difficulty concentrating, feeling with diminished energy. Also socially, you may want to isolate a little bit more than before. And all of this is part of the experience of pain. And this is why we have psychological interventions to help you with these changes that go beyond the physical symptoms. We follow the biopsychosocial model, which covers all of these things that I just mentioned. One of the experiences that the person may encounter is something known as the pain cycle. And this is something that happens when pain persists. And what occurs is that the person, due to fears of feeling more pain or re-injuries, the person may start to isolate or disengage from activities. However, this could be very negative to the person, both physically and emotionally. On a physical level, by disengaging in activities, what happens to the body is that it causes deconditioning. So when you decide to re-engage at a later time in physical activities, your body is actually at a higher risk of re-injury. Emotionally, what happens with that disengagement is that you start withdrawing from meaningful activities, from meaningful relationships, and that causes social isolation. Social isolation is one of the main symptoms that may exacerbate depression. Psychological interventions for chronic pain will help you break that pain cycle, and instead you're going to learn how to engage in activities in a more effective way by implementing activity pacing, which is basically alternating between active and passive activities. Activity pacing will help you to be more preventative instead of just waiting for the body to alert that there is more pain. So in a way, you're trying to prevent the frequency of flare-ups. The other experience that you may encounter when dealing with pain is that you may have noticed a shift in your thinking patterns. Over time, with persistent pain, our thoughts may become a little bit less optimistic than before. And what that happens is that you start interpreting situations in a more negative way, inflexible, and not as balanced as before. The result of that is that you will have experiences that will involve strong emotions, such as increased irritability, increased anxiety, depression. And every time we experience these strong emotions, what happens in the body is that the stress response gets activated. Having this stress response activated frequently throughout the day, for weeks, months, and sometimes even years, what happens is that it results in more inflammation in the body. Therefore, understanding the connection between mind and body is essentially important when you're trying to effectively manage pain. Some of the treatment goals that we have under pain health psychology include giving you tools to allow you to have a good quality of life, learning how to effectively manage your pain so that it doesn't become so limiting and interfering in your everyday functioning. One of the ways that we achieve this is by breaking the cycle of pain, paying more attention to your thoughts, and learning how to replace them into healthier thoughts. Other ways is to make sure that you continue to be behaviorally activated. You continue to find meaningful activities. This may be a time for exploration, a time for you to find new hobbies, new interests that may not be as physically demanding, but they are still meaningful and valuable to you. Another goal that we have under this side of the pain treatment is allowing you to maintain those healthy relationships. So if you're noticing that some changes with your mood are getting in the way of your interactions, your meaningful relationships, we can also help you with that. Ideally, the main goal behind this treatment is to give you tools that don't have any adverse reactions, tools that potentially could reduce your reliance on pain medications. The psychological interventions that we use for chronic pain that will help you achieve the goals that I had previously mentioned, one of them is cognitive behavioral therapy for chronic pain, or CBT-CP. This psychological intervention will allow you to become more aware of maladaptive thinking patterns, increasing your awareness of what is that internal dialogue looking like, how are you interpreting your pain, and how it is affecting or interfering with your everyday functioning is very important to know. One of the things that we'll do in CBT is that once you've become aware of that internal dialogue and you've identified that you are in fact engaging in these maladaptive patterns, we are then able to start challenging your thoughts and understanding that not everything that we think is 100% true. A lot of the thoughts that we have, including thoughts about our interpretation of pain, may not be based on facts. So learning how to challenge that and to discard those thoughts that are not helpful is the key component of CBT. CBT is very engaging. You're gonna have worksheets that you're gonna complete in sessions with me and outside of sessions as well. These worksheets include logs, like activity pacing logs and pain diaries. And the reason why we want to do this is because we want to have a better idea, a better understanding of patterns. Other components of CBT include relaxation exercises and sleep hygiene. Another psychological intervention that's readily available for chronic pain is acceptance commitment therapy, or also known as ACT. ACT is all about helping you to become more aware of the present moment and finding value and meaning of it. By having a better idea of what are your goals and making sure that these goals are realistic, and allowing you to move forward and to get closer each moment to that goal that you've identified. A lot of mindfulness is part of ACT in the sense you will learn how to be okay with what is instead of trying to change it with the idea that you have in your mind of how things used to be. You know, when we talk about pain, your physical body has changed a lot, and finding a way to accept what is going to be most helpful instead of ruminating about how things used to be or overly worrying about how it could be in the future. The other treatment modality that we have and we offer in the pain clinic is biofeedback. Biofeedback could be its standalone treatment, or it could be used in combination with either CBT or ACT. Biofeedback essentially is a device that we use that has several sensors. We will place those sensors in different parts of your body. It is not painful, and we're not introducing anything into your body. We're only gathering information. And the information that we're getting is we want to see how your body, specifically your autonomic nervous system, which is the one in charge of the stress response and the relaxation response, we want to see how that is responding to stress. What happens over time with persistent pain is that, as I had mentioned earlier, the stress response becomes overly activated, and that creates imbalances in your nervous system. Biofeedback is extremely helpful because you will learn how to regain that mastery, to use your own physiological responses to, in a way, recover naturally after a stressor has ended. Some of these sensors will measure muscle activity on each side of your body. We also gather information pertaining to respiration, skin conductance, specifically sweat activity pertaining to stress, and heart rate information. These are all the psychological interventions that are readily available to you at the pain clinic. If you are interested or if you have any questions, you can talk to your pain medical provider, and he or she will send a referral over to Pain Health Psychology. I thank you so much for listening, and I wish you the very best in your healing process.